Welcome, everyone, to the Solid Responder Podcast, where we share stories from first responders and talk about the past, the present, and the future in disaster response. Solid Responder highlights key issues in emergency response, exploring, engaging, and educating the emergency response community with featured guests from diverse all-hazard emergency response disciplines. Listen in as leading experts in the field tell their personal stories of dramatic and dangerous moments, the lessons that they learned, and how their skills and leadership were put to the test. Listen in as we talk about taking good medicine to bad places. I'm your host, Joe Hernandez, and the Solid Responder Podcast, squared away, right away. Hello, everyone, and welcome back to the Solid Responder Podcast. Today is March 16th, 2022. In an article published by GEMS Magazine back on June 30th, 2009, we read, quote unquote, all EMS vehicles should carry some type of sterile fluid for wound irrigation. Pouring fluids from a bottle often does not provide enough pressure to adequately irrigate a wound covered in debris. It continues to go on and speak about Irrisept being used as a wound irrigation system. It sure seems that we're still addressing the same issues of what to do with an open, contaminated wound in 2022. This next show is going to be very informative. My guest and friend is Dr. Gerald Klein, a board-certified allergist and immunologist and a board-certified pediatrician. He's an expert in medical affairs and clinical development. He is an associate editor, editorial board member, and reviewer for several medical journals. Dr. Klein has published numerous peer-reviewed journals, scientific papers, and white papers. Dr. Klein currently serves as a principal of MedSearch PI, a physician consulting company. Dr. Klein recently served as a lead panelist on an international podcast titled Wound Infection in Humanitarian Emergencies, viewed by thousands of medical responders, and we encourage you to look up and listen to that podcast as well. Today, we're going to discuss a recent review article published on April the 6th, 2020, by Emergency Medicine and Trauma Care Journal and written by Dr. Klein, titled Recognizing High-Risk Traumatic Wounds and Preventing Infections and Complications. And with that, I would like to introduce you to Dr. Jerry Klein, who will share his knowledge on wounds and more. If I can introduce Dr. Klein, thank you for joining us.
Thank you for having me. It's a pleasure to be here today.
Man, that article sure shakes a lot of boots on our end as pre-hospital responders, whether it's on the streets in EMS and or on a disaster response assignment, which puts tertiary care even further away from us. And your article has sure stirred up a new awakening and something that we really need to look into.
Well, I'm glad it did, because I think people don't realize the seriousness and the complications that traumatic wounds especially can cause, and I think too frequently it's taken for granted, and the initial management of the wounds isn't really sufficient. And if you for example, just using a simple solution like an antiseptic solution can do so much to prevent complications and serious morbidity and even mortality.
You know, in the old days, I know before I retired a few years ago, we ended up throwing every bottle of hydrogen peroxide out of our medical boxes and out of our medical storage closets. Something that we poured on wounds to disinfect wounds for many, many, many years. And I believe that we were really doing a disservice not only to the system, but to those individuals, patients, and the tissues that we were destroying at the same time.
Yeah, unfortunately, in healthcare, we make a lot of mistakes at different periods of time, but I think they've been corrected. And certainly a solution like chlorhexidine gluconate doesn't have those disadvantages.
And some of us in the pre-hospital environment aren't very familiar with CHG in that 5% point solution. We've
Point.
always been used
Yeah.
to it in a higher rate, use it on the uh, uninjured skin as a preparation to doing any type of suturing or any type of cleansing, but never introducing the higher percentages into a wound. Was there a reason for that?
Yeah, well, actually, just to chlorhexidine gluconate has been used for years, for decades, in higher concentration. It's used in mouthwash. It's used, as you say, the skin irrigation. It's used in so many different things. It's used in bandages. However, this lower concentration has been found to be safe and efficacious as a surgical irrigation solution. And this particular brand, Irrisept, is also in the self-contained bottle. So it also, when you use it, is at the right pressure. So it's at a medium pressure. Too low pressure won't work, and too high pressure has been shown to actually injure some of the tissue. So using this solution as it is in this container is really an effective way to do it, especially if you're out in the field and don't have access to water or other things, or if you're in a third world country, or you're in the military, or so many other places. It's a great first aid use.
And the other solutions we know already are kind of designated, i.e., our normal saline is designated for intravenous use. Therefore, utilizing one of those bags and/or bottles for irrigation now digs into that inventory, and it's not particularly the greatest size to use, especially in an austere environment or carried inside of a medical bag. And so my understanding is that they have just come out with or coming out recently with a new EMS version of 150 mLs, basically fits in the palm of your hand, with a splash guard, easy twist off top, and uh, under the $20 MSRP, from my understanding, and sure is going to be a great instrument back into our toolbox for wound irrigations, again, in the streets and in that austere environment.
And not only that, what people don't realize, also for simple surgical procedures like removing precancerous lesions on feet. So the elderly, have this all the time, and dermatologists are constantly removing these lesions. However, a significant factor get infected, because if you're an elderly patient with diabetes, and especially on the foot, it's a difficult area to heal. So these wounds frequently get infected, and I've seen a lot of people actually become septic and hospitalized do those procedures. So it's a great benefit to have just a small amount of solution, like 150 cc's, and you could use this right in the office.
Excellent. Not just a pre-hospital use, but definitely an in the clinic use, and in the office use, a home health use, urgent care center use. I mean, the list is ongoing and ongoing. I know that you are very familiar with using this type of product within the surgical environment as it was intended originally, for breast augmentation, cleaning, and obstetrical issues, especially in our developing countries, as we have seen in humanitarian aids, and now seeing it a smaller version, not hospital sterile, but still clean, sterile for our environment, is such a welcoming use. And what you just said, Doc, about the use in these lesions, that they're not necessarily injuries. And we do know that EMS is sure called a lot to not just injuries, but to illnesses and discomforts, i.e., post surgery events. And now, with the introduction of the community paramedic program and community paramedicine, boy, sure would look like something they could use in their tackle box to go back to those individuals who now are at home post-op to be able to do some practical wound irrigation and some good solution introduction, and being able to bill for those services as they all want to.
Yeah, that's really great because they could use this for prophylaxis or therapeutic intervention for irrigation, for acute wounds, gunshots, like I said, trauma, bites, or to help in the post surgical wound infections and the daily care, because this will really help decolonization of the wounds. Um, and like you said, post surgery too is a big factor. The people don't realize how bad infections still are. And the problem we also have today, as you're well aware, of antibiotic resistance. So one of the benefits I like about this product, it's not an antibiotic, it's an antiseptic, so that you're not going to further increase the possibility of more resistance to antibiotics.
That is a fantastic comment, because sometimes we will hear in the austere environment for disaster response, if they would go ahead and allow for antibiotic usage during some of those contacts and or open wounds, et cetera. And if we can avoid using, as you said, antibiotics where we're creating anti-resistant issues, cleaning those wounds properly with an antiseptic may be a solution. As they say, the solution to pollution is dilution, and so absolutely is an answer.
Yeah, most definitely. And I think when people, look at wounds, they really have to take a lot of things in consideration. The size of the wound, especially if it's greater than 5 centimeters, has a much higher chance of becoming infected. The location, as I mentioned, if it's on the lower extremities or some other places that's hard to heal, like the neck or the back of the hand, uh, the the type of patient that you're dealing with, is it an elderly patient, is someone who's immune compromised, or do they have diabetes? When almost a third of the population either has pre or diabetes or is obese. So they have a much greater chance of becoming infected with their wounds. So it's really important that these wounds are handled properly, and that a antiseptic irrigation solution, I think, will go a long way in helping to prevent a lot of these problems.
Wow, definitely agree. And if you add to that the type of injuries, as you mentioned earlier, compound fractures, dirty wounds, puncture wounds, and even you went into the article, which was very interesting, the fact of animal bites and how many individuals in this country actually receive a bite from an animal.
Yeah, as I was doing more and more research, I was just astonished at the number of animal bites there are. But when you think about it, there's something like 175 million dogs or 180 million cats as pets. And so they're very common bites by accident or, intentional or on purpose. And then there's human bites, which are even worse a lot of the times, from fights, trauma, or accidental, sometimes sports injury. So that, and those are, again, puncture wounds, as you mentioned. So those have a much greater chance of becoming infected.
So being proactive on the pre-hospital side for an automobile accident, industrial accident that would involve a dirty wound, possible fractures, road rash, etc., we would be doing a great justice not only to the medical system, but also to the patients and their family members by irrigating these wounds with solution.
Right. And this is such a simple thing, and it could be so cost effective if you think that this helped prevent hospitalization. I don't have to tell you the extreme costs of, someone going into the hospital to treat an infected wound. It's just astronomical, and it's only getting worse. And especially if we have another round of any type of pandemics when the hospital's already overcrowded. And what happens is that a lot of these people, their initial wound is not treated properly, and then it gets infected, and it's very difficult for them to get to urgent care or emergency room, and it's because they're closed or over full of uh, pandemic patients. So it becomes a major problem, and these people just get sicker and have more complications.
You did say something that sure was echoed across, I would say, over 80% of the first responders in this country, was that the majority of patients that they encountered wanted to be assured that they were okay, but at 100% did not want a visit and or go to the hospital, being that afraid of the exposures during the COVID response and what was going on. And should we, again, as you just mentioned, go into another pandemic again, we are going to see a lot of infections progress. And here we're in the US and we do have a great healthcare system. You can't imagine the developing countries and morbidity and mortality. Here, prosthetics are available. We go into another country and you might just as well put them on a uh, welfare system by taking off a limb, taking away a lot of their abilities to work in another country with an amputation, with an unclean wound. So, and I was just thinking of the injustices that we do, i.e., the Surfside building collapse, the Haiti earthquake, on disasters, not cleaning wounds, but just dressing them and sending them off to that tertiary care, not knowing how many hours or days it's going to be before those wounds are even looked at and or cleaned. And we could start right there and then at the moment.
That's an excellent point in the emergency situation like that. I mean, even in the U.S., when you had condos collapsing and big things, how many people are just going to be waiting hours and hours to get really treated because they're people who have more severe injuries, but then their injuries can become a lot more severe because they're not treated initially the proper way. So I think it's really critical using something like Irrimax in these situations to prevent the increased morbidity and mortality is really essential.
I think it's fantastic. And being an FDA cleared system for antimicrobial wound lavage, uh, sure sounds a lot better than using normal saline and filling up 30 or 60 cc syringes with a catheter at the end and squeezing them and refilling and squeezing them, and or using any air powered. Here just mechanical 150 cc's, use and discard, just sounds so much easier, and that we will be doing a justice again to those patients and their families. You mentioned the dirtiness of all of those wounds and the complications of all of those wounds, and then lead to that the factors of age and history of those persons. It's a ticking time bomb.
Yeah, for sure, for sure. And so I think that these wounds should be treated very aggressively to prevent future complications. Um, and even younger people, athletes, teenagers, if they have an open fracture or something else, they need it treated aggressively. Um, and just because they're young and healthy doesn't mean that they can't get infected and develop problems with this. We've seen that with professional athletes who have recurring injuries and they just get tremendous disability and can't recover from it. So it's really important to treat this stuff aggressively.
I was able to speak to an agency in Arkansas that was able to use the larger bottles that had been sent out as samples, from my understanding, during a motorcycle uh, road accident. And they used several bottles on that victim and did follow up that he was doing well. And a lot of it was due to them being able to remove a lot of the debris, a lot of the embedded dirt, sand, asphalt that was into those wounds, and then dressing those wounds. My question was to them was, were they at any time worried about any of the bleeding that was going on? And their response was that even though it did have active bleeding in those loss of tissue sites, their actions, and knowing that their actions was a cleaning system that they were able to use prior to bandaging, it didn't stop them at any time. Yet I've heard some individuals worry at a point, and ask that if the injury has stopped bleeding, why would they again irrigate it and potentially cause a breakage of a clot, a loosening of a clot, and rehemorrhaging that wound? Uh, the answer sounds pretty simple, doesn't it, Doc? Just
Yeah, I mean, again, if you're not using a high pressure system and you want to prevent infection, you want to make sure all the debris and everything is cleared out of there. And when you irrigate, you're removing, as you mentioned before, lots of bacteria, microbes, all sorts of other things. And studies have shown how you improve the bacteria clearance. And it's important to have that antiseptic there to prevent the infections, which is much worse than, the probability of severe rebleeding.
Man, I sure would like to see the publications in the educational system as it's changed in the last 10 years. I remember when, God forbid, a paramedic would stick a finger inside of a wound to pack it and stop bleeding. That was a big no no. And now, of course, they're telling us to stick that finger in and pack the daylights out of that wound so that we can tamponade that interior hemorrhage and control. And sure would like to see the publishers, AAOS, Nancy Caroline, and the rest, begin to look at wound irrigation and lavage systems and point 0.05 CHG use in open wounds for antimicrobial disinfecting and cleaning, and potentially changing those manuals.
Well, certainly they use it in surgery. They're using it in all sorts of surgery like that, from orthopedic, GYN, GI. So it's wide use in those situations that you're talking about. And there's lots of data and publications. So I agree 100% with you. They should be talking about it.
I hope they do get on board soon. And one of the things, when you just mentioned about feet, I know with disaster response, and I know that the Army, foot care is of essence. That is, you keep someone's feet happy, and you keep that soldier and or personnel, response personnel, happy as well. And I know that that is the number one knock on the door after their round of deployment for that day, coming into the evening, of knocking on, saying, "Can you please help me with my feet? I've been walking in wet boots or wet socks and I've got blisters. My feet have been exposed to bacterial contaminants in the flood waters of that hurricane and or tornado, what it brought with us." And we are handing out moleskin. We are cleaning wounds. And up to yet, we had really no instrument. Now a smile comes on my face looking at a preventive package that could be given to each member to avoid medical personnel having to do simple procedures of giving them all antimicrobial wound irrigant to clean their own blisters and to put moleskin and clean their own feet and keep themselves happy. It's just another added tool, not just in the medical box, but in our responders' normal day-to-day activity box.
Oh, absolutely. And, when you talk about feet and wound care, you have to talk about diabetic ulcers and diabetic foot ulcers. Tremendous problem that's getting much, much worse. And, there is really nothing that has the indication for that per se. But just think about that. If they use this to clean that wound and to use it when they change the dressing and try and prevent the progression of these wounds, could probably prevent a lot of amputations and other problems down the line.
Huge change that can be done just with a simple bottle that has an incredible compound in it, and just opening our minds to not being so stuck on what we do and putting a band-aid on a nasty, dirty wound, but now irrigating that wound and doing a better justice, even to the fact with the community paramedicine, to be able to leave a bottle or two with those individuals and come back and checking on them, where they can easily, with instructions, do a self wound lavage and move on.
Yeah, absolutely. It'd make, I think, a big difference to healthcare and really cut the cost of these expensive problems.
I was also reading in your article, we do in the disaster response community, Canine is a part of the search team and really can't survive without having a search canine component. The paramedics and physicians on those teams are responsible for canine care and treatment. And my understanding that this product is absolutely perfect also for use in canines as well.
Oh, absolutely. In fact, before you had human use, this was used in all sorts of veterinarian care, and absolutely in dogs, cats, and large animals. So, definitely is a great um, therapy for dogs and other animals.
Dr. Klein, I can't thank you enough for giving us some of your time, for publishing an incredible article uh, in the Trauma Care Journal, giving us information on high risk traumatic wounds and how to prevent those infections, uh, taking your time to speak to the community, response community today, making yourself available should anyone have any questions further on about wound irrigation and or about Irrimax and or Irrisept and the new 150cc bottle. Um, Dr. Klein with MedSurge PI, thank you so much for this time, and I hope you have a wonderful, wonderful day.
Thank you.